afternoon, everyone. The topic of my presentation is clinical profile of NAION and its association with systemic diseases with special reference to OSA. Introduction. Anterior ischemic optic neuropathy is most common acute optic neuropathy affecting adults older than 50 years. AION is basically categorized into two categories, arthritic and non-arthritic. The non-arthritic form of AION is often related to systemic risk factors like diabetes, hypertension, hyperlipidemia, obstructive sleep apnea, and smoking. The aim of the study is to study the systemic risk factors associated with AION to assess visual parameters before and after the treatment. Materials and method. Study center was Department of Ophthalmology, SSMC Riva. Study duration was Jan 21 to June 22. Study design was prospective observational case control study. Study population were 32 cases of AION and 32 age and gender matched controls. The inclusion criteria were patients with characteristic features of AION. The exclusion criteria were patients with other causes of dyschedema and other retinal and optic nerve pathology that could cause defective vision and field changes. Material and methods. Demographic data of cases and control, detailed ophthalmic and medical history were taken, such as diabetes, hypertension, hyperlipidemia, smoking history, and OSA risk was assessed using stop bank questionnaire. And the relevant lab investigations were done. Comprehensive ophthalmic examination, visual acuity in logMAR unit, contrast sensitivity, and OH parameters on OCT. Materials and method follow-up was done at 1 month and 3 months. Comparison of risk factor was done by odds ratio, statistical analysis by chi-square test. The mean age of the cases and the control and the male and female ratio were almost similar. Systemic risk factors, diabetes was present in 62%, hypertension in 48.87%, obstructive sleep apnea in 59.37%, hyperlipidemia in 31.25%, and smoking in 40.62%. Significant p-values were noted in case of diabetic, hypertensive, and OSA, with the respective odds ratio of 4.2, 11.57, and 7.8. The results, the initial presentation at 1 month follow-up and at 3 month follow-up, we saw the color visual acuity, the color vision, and the contrast sensitivity. We found that the visual acuity and the contrast sensitivity did not change much, but the color vision was significantly improved. The main systemic disease found to be positively associated with AION were hypertension, diabetes, and obstructive sleep apnea. However, no significant association of smoking and hyperlipidemia with AION was seen. Hyre et al. And Das et al. And Saxena R et al. Also reported similar risk factors to be significantly associated with AION. In addition, Saxena R et al. Also observed a significant correlation of smoking. OSA as a significant risk factor for AION was found in our study, which was similar to that of K. Palombi et al. And Jain Lee et al. We found no association of disease with hyperlipidemia, but Vincent A. Demro et al. Study found a positive association of hyperlipidemia with NAION. The present study concluded that AION has a significant association with diabetes mellitus, hypertension, and OSA. Improvement in visual parameters were not seen to be marginal in visual acuity and more for color vision and contrast sensitivity. As visual improvement is rarely seen in the affected eye and the other eye is also at risk, so identifying the various systemic risk factors and treating them becomes paramount importance to prevent follow eye involvement. Thank you.
Your presentation is okay, but unfortunately we cannot score any mark. One. Second, in future, if you want to present, always take a permission from the chairman scientific committee. Then if, but yeah, okay, fine. This we allowed, but not score the mark.